Dear children, let us continue with chapter 7, Human Health and Diseases. The bacterial diseases. These diseases are caused by pathogenic bacteria. Pathogenic refers to the organism that causes infection. Such pathogens may emit toxins. These organisms emit some poisonous chemical substances that affect the body of an individual. The bacteria can spread through air, water, or by inhaling the droplets. The droplets which are released during the time of coughing and sneezing, if inhaled, may spread the disease. The aerosols are when the bacterial particles are suspended in the air, or sometimes they can be transmitted while sharing the utensils used by the infected person. Also, when we share the dresses of an infected person, the disease can spread from person to person. Some common bacterial diseases are Shigellosis, bubonic plague, diphtheria, cholera, tetanus, typhoid, pneumonia, tuberculosis. So, what are the common bacterial diseases? Shigellosis, bubonic plague, diphtheria, cholera, tetanus, typhoid, pneumonia and tuberculosis. Let us go into the first bacterial disease called as the Shigellosis, the bacillary dysentery. This disease is caused by the Shigella species. It commonly infects the intestine of an organism. This disease is transmitted by contaminated food and water. When the food and water is contaminated with the feces, or you can say that the fecal oral route. The disease is transmitted through the fecal oral route. The common symptoms of this disease is abdominal pain, dehydration, blood and mucus in the stools. Blood and mucus in the motion they pass or the feces they pass. So very important, you have to be very careful with the personal hygiene and cleanliness to prevent the spread of this disease. The next disease is the bubonic plague, Black Death. This disease is caused by Yersinia pestis, which affects the lymph node, and it is transmitted through a rat flea vector called as the Xenosila capus. The rat is responsible for transmitting the bacteria into the fleas, and when these fleas come and bite the human beings, they are responsible for transmitting the disease called as the plague. The common symptoms are fever, headache and swollen lymph nodes. Ultimately, it results in the turning of the nails blue, ulcerations, rashes, lesions appear on the skin. So this is a very dangerous disease and it resulted in the death of the individual. So it is called as to be the Black Death. The next disorder is the diphtheria. It is caused by Corynebacterium diphtheriae. It usually affects the larynx, the skin, nasal and the genital passage. Usually it is transmitted through the droplet of an individual while coughing and sneezing, also by direct contact with the patient. The common symptoms are fever, sore throat, hoarseness and difficulty in breathing. The patient will have fever and he will have some pain in the throat and difficulty in speaking as well as in breathing. Cholera. Cholera is caused by Vibrio cholerae. Vibrio cholerae affects the intestine. They are transmitted by the fecal oral route. That is when a person feeds on a contaminated food and water, may get the disease called as the cholera. The common symptoms of this disease is severe diarrhea and dehydration. Most of the people remain asymptomatic, but some of the other symptoms are the watery stool, stomach pain, leg cramps, mild fever, vomiting, sunken eyes and cheeks, dry mucous membrane, decreased urinary output. So this is a disease which is caused due to the unhygienic conditions practiced by the people as well as the contaminated food and water. So it is advised that we practice cleanliness as well as we boil the food and water properly and consume. The next disorder is the tetanus, called to be lockjaw. It is caused by Clostridium tetani. It infects the spasm of muscles. The mode of transmission is through the wound infection. A person suffering with the wound which is not healing for a long time may result in the spread of the infection through the wound. The patient may experience rigidity of the jaw muscle, increased heartbeat rate, and spasm of the muscles of the jaw and face. Other symptoms may include the fever, high blood pressure, locked jaw, sweating, difficulty in swallowing. Locked jaw is nothing but the spasm of the muscles of the jaw and face. Typhoid, the enteric fever, caused by Salmonella typhi, affecting the intestine, and commonly it is transmitted through the contaminated food and water. The symptoms may be the headache, abdominal discomfort, fever, diarrhea. Additional symptoms can be high fever, weakness, dry cough, stomach pain, constipation, and rashes. So this disorder results due to the lack of proper hand washing. Consuming food without washing the hand properly, as well as consuming the contaminated food and drinking contaminated water is the main cause of this disorder. So you are advised to wash your hands properly before eating and drink boiled water. The next disorder is the pneumonia, which is caused by Streptococcus pneumoniae. This usually affects the lungs of the patient and it spreads through the droplet infection. A person who sneezes and coughs is responsible for spreading the disease through the droplets. And the symptoms include fever, cough, painful breathing, and brown sputum. Sputum is the mucus-like secretion that comes out of the mouth while coughing and sneezing. It may also cause the muscle aches, dry cough, abdominal pain, cold in the head and the throat, fever with shivering, chest pain, nausea and vomiting can be included as the additional symptoms of this disorder. The next disease is tuberculosis. It is caused by Mycobacterium tuberculosis, commonly infects the lungs, and it spreads through the droplet infection when a patient coughs and sneezes. The common symptoms may be the formation of thick mucopleural nasal discharge. The other symptoms include coughing and blood when coughing, chest pain, weight loss, tiredness, fever, night sweats, chills, and not feeling hungry, that is loss of appetite. It is advised that you should cover your mouth while coughing and sneezing. Usually people consume more antibiotics to treat the bacterial infections. If we consume more antibiotics, the bacterial strains may become resistant to the antibiotics and it becomes very difficult to cure the disease. So it should be taken care that we are not using antibiotics for treating minor infections, and antibiotics are not referred for viral infections also. So we have to consult a physician or a doctor before taking any medicines to treat the disorder, because constantly consuming antibiotics may make the bacteria resistant to the disorders and may not be able to cure the disease. Clear, children? So with that we wind up with the bacterial diseases and move on to the viral diseases in the next video class. Thank you, children.